Hi there, Todd Cameron here, GP and Medical Director at M3 Health. You have received this video because it means that your GP has determined that you have had close contact with a known COVID positive patient. And most typically that would be through the household. So there's some special advice around this, and the message that you received, the link to this video, will also have a link to the Australian government documents around COVID close case contacts. Typically that means you will have been contacted by public health officials because they're doing what's called contact tracing. So what that means is that you are currently well, but within the last 14 days you have had contact with somebody that is a known COVID case that is considered to be close. So that means the duration of contact and the proximity is enough to say that you're highly likely to contract COVID. So what do you do? Well, 14 days of isolation from the last time of contact with the known COVID positive person is really important. You need to stay home. It is really, really important that you don't leave the home unless there is absolutely no way of avoiding that. And that may be for something like a medical appointment, and we'll walk you through that in a moment. At home, make sure that you have meticulous hand hygiene. So regularly washing hands, soap and water is by far the best. At least 20 seconds. Make sure that you're covering off on all of the surfaces on your hands as you wash them, and that you're very, very thorough. You watch exactly where the soap goes. If you do need to dry them on a towel, that's fine. Just make sure that you're regularly washing the towels and that you're not leaving wet, soggy towels around for other people to use. Wherever possible, if you're in a household where there are other members that cannot leave, so you should not have visitors over during this time. You should not have anybody that doesn't need to be in your house. Home. If you are yourself the person that has had a COVID positive contact, then do your best to isolate from the other household contacts, be they friends or family, because if you do become unwell, then it is likely you are able to spread it in the period of time before you become unwell. So treat yourself as if you may have it, which means isolate to your room. If it's avoidable, don't prepare food for others, and don't offer care to others in the household. Leave that for people that are not in the COVID close contact category. If you do need to leave the home for any reason and it is unavoidable, wherever possible you should use a surgical mask. They're the ones that clip over the ears. They're usually blue with a couple of folds on them. You should be able to get those from your GP clinic or from your pharmacy. I've been Todd Cameron. I hope this is useful. Make sure you download the associated government document as well, which is in the original message. Bye.